The worst thing that happened to me in my life was my mom getting diagnosed. And even working at the center I worked at, I remember at one point saying, thank God my mom doesn't have breast cancer because she would never do treatment. Little did I know she had already been diagnosed with breast cancer. It just wasn't official yet. So my name is Leah Stephanishin, and I'm from a small place in Saskatchewan, Canada. And I am here because my mom had been diagnosed with ER/PR positive, HER2 negative breast cancer that had metastasized to her bones and liver. So I am a nurse back home in Canada. I work primarily with women, and I actually work at a diagnostic breast health center. So we deal with women dealing with breast cancer. We're the surgical stage before they go on to treatment. I was apprehensive. I was very nervous, and given the fact that I never thought I'd be in this situation, so it becomes more of a personal decision. So in my mind, the nurse speaking, I was very apprehensive because I was scared that we have treatment at home. Like, are we wasting time? Gosh, just to say you're going to Mexico for treatment, it's just one of those things that you hear people do, and you don't think you'd be in that situation to even consider that. So I was leery for sure. So currently, she is doing the low dose chemo, and chemo for my mom was never an option. She, in the sense of that, she just never wanted to do it, and I wanted her to do it. Being the medical portion, knowing what chemo does, everything like that, and kind of with the extent of her disease, the fear that she didn't do something, even chemo-based, would put her in a worse situation. So hearing that this was an option that she was even considering was huge. It was almost like a tipping point. If she's going to do treatment, great, let's try it here. She kind of runs the show. And not only with the treatment of the chemo, it's the encompassing treatment with the Reiki. She's very involved with a holistic treatment, living this way. It just oozes out of her. So the vitamin therapy, the Reiki, the psychology, even in the environment of being with other patients and interacting with that, it was just so up her alley that it was hard not to come. It differs greatly in the sense, back home, they still listen to you. They still want to put you first. We just don't have the options. Like, it's not a one size fits all type thing, but that is how it seems like it is treated sometimes. So either you have hormone therapy or you have high dose chemo, and those are your two options. So to know that she here had more of a say and can ask questions and, okay, what is this going to look like? Am I going to be sick? It's just tailored very different. So it's very patient forward care, which we do at home, but not to this extent. Again, coming from the nursing standpoint, yeah, very apprehensive, but until it's your mom. And when I would see her in her oncology appointments back home, and the life just drained from her, hearing what her options were, and the fear and the tears, and my mom's a strong woman, and just seeing that drain out of her instantly, it's almost that fear where she already knows it's not going to work for her, so it's not going to work. So it's a huge leap for sure to consider treatment outside of Canada. We do have good treatment, but it's, like I said, it's not a one size fits all. Sometimes you need to take that leap, and to see the care that she has gotten here, it's mind blowing. And to see the smile on her face, and to see her happy and rebounding well from treatment, and the thing that scared her so much to get chemo. And I sat with her yesterday through her first dose of chemo, which I never thought in a million years I would. So you gotta take a leap. And especially with healthcare workers, you have to make it personal. You have to put yourself in the patient's shoes and and see the fear with this diagnosis even to begin with, and then all the symptoms that do come with it. Why not try something that is going to still have some sort of benefit? There has been studies, and still have them enjoy their quality of life. We stress quality of life so much, so why not give it a go? Even when she got here, she was still reluctant. It wasn't until she met the team. The doctors are incredible. The nurses have been amazing. And hearing the patients, and I don't even like calling them patients because it doesn't seem like it's a patient place right now. These are very happy people, and sure, don't get me wrong, there are rough days. We've seen people have rough days, but that's part of the process. But yeah, it's just a family unit. It sounds so silly seeing that I've met people just a week ago. It just has this core of being a family unit, and so strongly patient forward. You're heard. I can ask any question under the sun. Mom's questions have all been answered. There's been check-ins when she hasn't been in the clinic. Just the care you receive, and especially when you're in a foreign country and you're scared to begin with, has just been mind-blowing. It's just been the reassurance of everything, and listening to other people involved in this clinic. They're happy with the care. They feel confident. They feel confident going home. There's going to be follow-up. There's no kind of question unanswered, which that's the thing in Canada. It's slow. It's slow. Time isn't in our favor, it seems, back there. It's a whirlwind. I'm leaving tomorrow, and I'm sad to be leaving. I'm at peace so much in my heart, seeing her the way she is here. It was the perfect fit for her. And it actually just, even, your mind goes to the what ifs, and what if she did treatment, and I'm not saying that it wouldn't be good at home, but it would be just very different. This is just so tailored to her being, and it's hard to even explain, but it's just such a comforting feeling to see that she's responding well, doing well to this treatment, and just feeling like herself still throughout this. Because I think that's one thing that gets so lost, is at the end of it, you just don't feel strong, you don't feel healthy, you're exhausted. And how are you supposed to continue to fight such a terrible disease when you just have no life in you, not even physically, but emotionally? So that has just been like the cherry on top with all of this, is just to even see her emotional aspect. It gives her that extra fight in her. So yeah, it's been incredible, and I wouldn't doubt it for anybody. Really, honestly, I wouldn't. I think it's a great option to consider for people.